Hello again, and welcome to my third video in the series titled What Happens to My Body When I Have Diabetes. Today we're going to talk about the complications of diabetes. Why is it so important for us to keep our blood sugars controlled at a normal or close to normal level? What happens when that doesn't happen and when the blood sugars are very high over a long period of time? So the easiest explanation that I can give for my patients is to tell them that when the blood sugars are very high, your blood is very thick like syrup. It has a really hard time getting into the blood vessels in your eyes and in your kidneys and in your feet. And that's why we see specifically damage to these organs, although we also see damage to other organs in the body as well. So what happens when the blood can't get into these organs, and so over time they have this chronic circulation problems and they don't get enough oxygen? Well, the organs start to be damaged. We start to see loss of eyesight. We see kidney damage, and eventually patients end up on dialysis from this. It might take 10 years, it might take 2, it might take 20, we don't know, but it happens over time. And then with the feet, that's a big problem. What we see starts off as diabetic neuropathy, which is a numbness or tingling in the feet. Some patients experience pain, and we can give medications to try to control the pain, but the best thing we can do to prevent the progression of diabetic neuropathy and the rest of the diabetic complications is to keep the blood sugars controlled. What happens when the neuropathy progresses is that patients often lose complete feeling in their feet. And if you can't feel your feet, you don't know if you stepped on a piece of glass or a nail or something like that, or just got a blister from shoes that are too tight. And so usually a small wound will become a big deal because one, you don't know it's there, so you're not checking on it, making sure that it's healing up properly. 2, you have very poor circulation from the diabetes, and a lot of times other diseases like peripheral vascular disease, which usually goes a lot of times hand in hand with diabetes. So you have very poor circulation. So the wound doesn't heal because wounds need oxygen for healing, okay? And the blood is what carries the oxygen to the wound. So it doesn't heal up very well. On top of that, your blood sugars are very high. This is a very good breeding ground for bacteria. The bacteria, they love that sugar. They thrive on it. So you have this trifecta of events going on. And so what started out as a very small wound will quickly become an infection that is out of control and difficult to treat. A lot of patients will end up in the hospital on IV antibiotics. We try to heal them up as well as we can, but a lot of times with diabetic patients, this is why we see a lot of amputations with diabetics, is because these what starts out as a small wound becomes something really serious. And like I said, the best thing that we can do from our end is keeping the blood sugars well controlled. The other complications of diabetes that we see frequently is called diabetic gastroparesis, and this is like nerve damage to the stomach, which causes like chronic nausea, vomiting, and it just makes the blood sugars that much more difficult to control. It's like a cycle because patients are not eating consistently, so sometimes we'll see some drops in blood sugar and things like that. Another complication of diabetes that I want to mention is the possibility of erectile dysfunction. That's not something that always comes up in the hospital setting, but is a very real complication of diabetes, for the same reason as all the rest of the complications: the lack of circulation, lack of blood flow, nerve damage to the penis. And so, some of our male patients would probably, be interested in hearing about that. But just like anything else, the key is keeping those blood sugars well controlled. The other complications of diabetes that we worry about, which are also, for the same reason, that thickening of the blood, we see an increased risk of heart attack and stroke. So that's something that, especially patients who are already at risk of having a heart attack and stroke, who have other risk factors, that the diabetes just makes it that much more likely. So we really need to work on that as well. If you have any questions for me about these complications, feel free to post it in the comment section, and I'll try to answer it to the best of my ability. As always, feel free to share this video with family and friends, healthcare providers, nursing students, patients if you are a healthcare provider, or anyone else that you think would benefit from it. Don't forget to subscribe to my channel so you can so you don't miss out on future content as well. Thank you and have a good night.